A very warm welcome to IDFC First Bank presents Leaders of Tomorrow Season 11. I'm Ritwika Gupta. It's National Nutrition Week, a significant annual event in India observed from 1st to 7 September, dedicated to raising awareness about the role of nutrition in our lives. Today, we will be doing a special episode dedicated to the importance of a nutrition-rich diet. And the spotlight is on Herbalife, a company that addresses gaps in nutrition through targeted dietary solutions and proper nutritional guidance. On the show today, I'll be chatting with Dr. Kent Bradley, Chief Health and Nutrition Officer, Medical Affairs and Nutrition Education, Herbalife, and Ajay Khanna, Senior Vice President and Managing Director of Herbalife India. Thank you so much, Dr. Kent and Ajay, for joining us today. So it's National Nutrition Week in India, and the timing couldn't be more apt for a discussion on nutrition. Dr. Kent, to kick things off, I'd like to direct the first question to you. In light of the influx of various players entering the nutritional supplement market in recent years, could you tell us what sets Herbalife apart? If you can elaborate on Herbalife's distinctive factors?
Thank you for that question. And it's great to be here with my colleague and friend, Ajay. First, I'm excited that India is focusing on nutrition. It's so important. And yes, there probably is new entrants because there's such an issue that we have to address, and that's the education. And the quality of the nutrition that people are taking in. So Herbalife has over a 40-year history, number one healthy shake in the world, and it is. We don't actually have enough time for all the ways in which we are set above and beyond. But it starts with our quality, the quality of our products. It's so difficult, really, to be able to have quality products, meaning not just that they're safe, but they're made in a way that ensures that what's in the shake is exactly what we say is in the shake and nothing more. That consistency happens through a very deliberate scientific process. The second would be people are no matter how nutritious it is, it's got to taste good, and we really know how to make shakes and other supplements, but specifically shakes, taste good. And third is our thoughtfulness through over 300 scientists that are found around the globe, and specifically with our centers of excellence within India, on how to properly make and combine ingredients in a way that meets specific nutritional needs. So those are three definite ways in which we're proud to be a part of India's nutrition support through our products, and of course through our distributors who bring these products to market, as well as provide the healthy community that's so needed.
Now, Ajay, coming to you, a recent Lancet survey found that about 11.4% of people are diabetic, while 35.5% suffer from hypertension in India. How does the high prevalence of lifestyle diseases impact a country's economic growth, in your opinion?
Lifestyle diseases, of course, they continue to remain a major concern for India, and which are basically arising out of lifestyle habits of individuals, like unhealthy eating habits, which detract people from regular activities and push them towards a sedentary routine, leading to chronic communal diseases with I would say life-threatening consequences. And as you said, that the non-communicable diseases in India account for almost about 62% of all deaths and 48% of preventable premature death. It is estimated that more than 2/3 of premature deaths can be linked back to NCD risk factors like poor diet, physical inactivity, sedentary lifestyles. And keeping this in mind, it is very important that the public-private partnership, they play a vital role in strengthening a country's healthcare services. I mean, I'm really proud that at Herbalife, we collaborate with the Food Safety Standards Authority of India, which is FSSAI, for the Eat Right campaign, and which is aligned with the National Health Policy of 2017. Just to give you a little bit perspective about this joint initiative, which is focused on promoting awareness about nutrition, healthy living, and that has led to engagement with more than 40 institutions, including state secretariats, Indian Space Research Organization campuses, police training centers, university colleges, just to name a few. And the objective is to ensure access to safe and balanced food choices for all. When we look at, in tandem with this effort, Herbalife has also facilitated events like walkathons, food summits, community festivals, to emphasize on the critical role of nutrition in overall well-being, or what we call as holistic well-being, in cities like Surat, Bangalore, Hyderabad, Chandigarh, and even up in Kargil. And as Dr. Kent also said, our nutrition philosophy has always been underpinned by a belief in the importance of a healthy lifestyle through exercise. And with more than 40 years of global presence and expertise, our product categories range from weight management, energy and fitness, targeted nutrition, kids range, and in India, we also have, Ayurveda. So a wide range of specialized nutrition products which are available with Herbalife, and committed to wellness through high quality, science-backed food products for everyone.
Now, Dr. Kent, just bringing you in here, how would you characterize India's health and wellness market on a global scale? What is your perspective on the country's market size moving forward?
I think that we have seen the strength and power of India as it is economically has grown, but the market itself in the healthcare sector is actually growing at a very fast rate, and that's not necessarily a good thing. That healthcare expenditures are increasing. But what is that there's a preventive healthcare market. The healthcare sector is expected to grow about 22% CAGR, the annual growth rate, and reaching maybe up to about 197 billion by the year 2025. So clearly consumers and the marketplace realizes there needs to be a proactive way in which to address health needs.
Absolutely. Ajay, despite greater dissemination of information, it is estimated that more than 80% of Indians might be protein deficient. How can initiatives, such as the Nutrition Week, help tackle nutritional deficiencies in the country?
Whether you're trying to gain muscle or lose weight or improve immunity, protein is the key. And protein is an essential, micronutrient that plays a crucial role in the overall health and well-being of the human body. And I think, Dr. Kent, you would agree with that. It's particularly important for women who require adequate, protein consumption to support various, psychological processes such as muscle development, bone health, and hormone regulation. And I would say, issues like protein deficiency, malnutrition, child mortality, and hunger, they still loom large over India's growth and development story. And as I shared earlier, our partnership with FSSAI is centered around two important goals. Firstly, promoting nutrition knowledge, and also ensuring the availability of safe and wholesome food. And I would say that India's right to protein needs immediate attention. I would say, and in line with the Eat Right campaign initiatives like Bharat Nutrition Week, this aims to raise awareness about the importance of nutrition, good food habits, and preventive healthcare. I mean, I would say the mega movement is a collective endeavor in line with our Honorable Prime Minister's flagship scheme, which is of holistic nutrition and Poshan Abhiyan, which is the National Nutrition Mission to empower a healthier and a nourished India. And I would say this is going to be very, very crucial. The Nutrition Week and raising the awareness about what healthy nutrition is all about.
Certainly. Dr. Kent, coming back to you, in an environment where nutritional supplements are becoming increasingly accessible, what steps do you think consumers can take to verify the authenticity of the products they're using? How can consumer safety be ensured while also keeping products affordable?
That's a great question, and I have to shout out to Ajay. I couldn't have said it any better around the power of protein and its role it plays in our overall global nutrition philosophy. But to your question about how does a consumer differentiate or understand, it's about trust. It's about trust in the brand, and with over 40 years of experience in delivering the highest quality products through a seed to feed and our scientists, we have a range of products from weight management to energy and fitness to targeted nutrition with over 700 products in 95 countries. Of course, in India, we also understand the power and the unique history of the Ayurveda and the power of plants in that regard. So we believe it has to do with trust, and that trust is in the brand, and because that brand represents that trust. The second is how we how does that product get to you? It gets through the distributor, who the associate in the community that you can trust, and so you can trust that we make sure the products are well made and of highest quality, but also that you're getting the actual product, right? Not some knockoff, because that product is being delivered to you via an associate. So those are ways that a consumer can know that the product they're getting is of the highest quality, by recognizing the brand and who is delivering it to them.
It's time for a quick break here. We'll be back shortly. Stay tuned. Welcome back. You're watching IDFC First Bank Presents Leaders of Tomorrow Season 11, celebrating National Nutrition Week today in a conversation with Dr. Kent Bradley, Chief Health and Nutrition Officer, Medical Affairs and Nutrition Education, Herbalife, and Ajay Khanna, Senior Vice President and Managing Director of Herbalife India. Ajay, just shifting gears a little bit, could you help us understand how you're helping to strengthen the agricultural ecosystem of India?
And continuing to what Dr. Kent said earlier about trust and all, about the brand, I mean, Herbalife conscious efforts are making a significant impact towards empowering the last mile communities across India. And in line with the United Nations Sustainable Development Goals, the company has undertaken two transformative community-level initiatives in rural India, which is by focusing on education and agriculture at the grassroots. The objective here is to uplift rural communities, provide I would say holistic nutrition, increase social security, and facilitate improved access in villages. And these last mile initiatives which are there in villages, they are measured on the impact and the larger CSR commitments in line with the I would say the sustainable development goals. I just want to share about a CSR initiative. In India, we have empowered farmers across 3 states, which is Karnataka, Rajasthan, and Madhya Pradesh. I mean, through this initiative, Herbalife has touched the lives of over 25,000 households across 85 villages. And we dedicated this initiative to improving agriculture and farming practices, thereby enabling farmers to uplift their economic status, and also giving them opportunity to learn about what is healthy nutrition, what is the importance of nutrition. Not only that, through our seed to mouth project, over 9,300 plus farmers have been trained with cutting edge resources, technology to reduce operating costs and improve market access in last mile communities. I mean, these are some of the initiatives which we are, working in India and investing through our time and efforts on CSR, etc.
Absolutely. Dr. Kent, there is a growing shift towards plant-based products among consumers. How can we guarantee the sustainable sourcing and production of these ingredients?
The investment in the seed to mouth program is how you can ensure the sustainability, but both by the education of the folks that are involved in the agricultural industry so that they are sustainable and able to continue to move forward. But also, we are aware that plants are nutrient dense, and which for us means that it has a lot of quality nutrients through our global nutrition philosophy, both with the macronutrients of protein, carbohydrates, and in certain cases fat, but also with the phytonutrients and the vitamins or the micronutrients. So we believe the plants are a wonderful source of all the nutrients that are needed. The key then is how do we deliver it to the marketplace and support both educating the food that they eat from the markets, but also through our supplements. And we are mindful to also be good stewards. And through that, we're mindful of climate and carbon footprint. We've improved our efficiencies through our manufacturing facility called HIM, the Herbalife Innovation and Manufacturing, which is a massive facilities both in U.S. and China and other facilities as well, where we've done solar-powered office space in India, as an example. We have a commitment to reducing our emissions globally. But we also look at product and packaging. And to that point, we think about reducing the use of what we call virgin plastic to only about 2%, 2 to 3% of total plastic. In other words, we're recycling plastic and putting that plastic as part of our post-consumer materials. So we really want to be good stewards, whether it's removing the plastic scoops in our products in Europe and Africa markets to eliminating over 45 metric tons of virgin plastic in 2023 and recycling over 5 million plus metric tons. We're definitely thinking about that. And there's also the issue of sourcing. We want to make sure that our suppliers are using good sustainability practices, and we set targets around that to assess that 80% of our products are, in fact, from our suppliers, sustainably derived.
Well, absolutely. But finally, Ajay, tell us, what are some of the tips that you would like to share for our viewers, in order to ensure overall health and wellness as we celebrate Nutrition Week?
First of all, I just want to say to all the viewers who are watching this that, celebrate the Nutrition Week and, with healthy nutrition, with healthy, active lifestyle and a holistic well-being, because I personally look at holistic well-being. When I say holistic well-being, it's all about, body and soul. And I do, of course, I'm blessed that I'm a part of Herbalife, where I have all the nutrition needs to support my requirements, whether it be about weight management, whether it be about wellness, whether it be about Ayurveda, whether it be about ocular defense, whether it be about gut health. I mean, I'm blessed to be a part of this organization. So from a nutrition perspective, I have everything best what I need, But from a soul perspective, and from a mind perspective, I do indulge at times, and I would encourage everyone to, do take out time to wind out, do go spend time with the nature. Now, I'm an avid bike rider, so I spend a lot of time biking Saturday, Sundays, whenever I get time. I do a lot of biking, and I also do a lot of book reading, for getting my mind active and always keep it working.
Fantastic. Dr. Kent, would you like to add to that?
Wow. I mean, Ajay perfectly said, because, to me, nutrition is about nourishing, and nourishing is about feeding what our whole self needs. And it starts with replenishing. So if we haven't been meeting our nutrient needs, it's about replenishing and restoring those needs. And what are those needs? It's about proper nutrition, clearly through what we've been talking about with the specifics around the macronutrients, the micronutrients, the plant-based nutrients. But it's also about rest and sleep, and restoring sleep to nourish our body so we can recover properly. It's about hydration and ensuring we get the water, but it's also about the social connections and the things that bring you joy, the recreation, the movement, the relationships. And really, most importantly, probably because we act because we think, and our thinking has such a big control. Just thinking about how we are able to nourish the way we think about ourselves and about our relationships, and about how we have the ability to really live our best life. And that's hopeful thinking, positive thinking, and an attitude that I think will pay big dividends.
Well, thank you so much, gentlemen, for your time. It was great chatting with the both of you.
Thank you, Ritwika, for this time, and especially talking about when we are celebrating the Nutrition Week. Thank you so much. And Dr. Kent, it was good to see you.
Thank you for giving us this time, and look forward to all that's going to be happening during Nutrition Week.
With that, it's a wrap on this episode of IDFC First Bank Presents Leaders of Tomorrow Season 11. We hope you enjoyed the discussion. Thanks for watching. Goodbye.